Hi, I'm Dr. Joanne Halbrecht, and I want to demonstrate what the medical assistant or nurse needs to do to prepare for the Lipogems fat graft procedure for the doctor. So I have already filled these syringes with the tumescence. Tumescence goes in a 500 cc bag of normal saline, in which I have put 50 cc's of 2% lidocaine and 1 amp of epinephrine. These are the supplies that we need, and so this comes with the kit as well as these two instruments that are used for harvesting, and then we also have a couple of 10 cc syringes that come with the kit as well, but I like to open up a couple of more because sometimes we need more, and then also I'm going to need a 10 cc syringe to drop some lidocaine to inject our local where we're going to do the harvest site. I use a filler needle for that, and when I'm injecting the area where I'm going to make the incision, I like to use a nice 25 gauge needle that's an inch and a half long so we can get more into the subcutaneous tissue, and this connector also comes with the system. What we also need is to have for the doctor an 11 blade, and you can either do a disposal or this one is a reusable handle. And it's always nice to have a nice pack of 4x4s because when we're making incision we do have some bleeding. So we're going to look to see where we want to harvest fat on this patient. If we pinch towards the sides, I'm not getting a lot of fat in between my fingers here, but more in the middle I can see that there's a concentration of fat here, so more in this area. Now I'm going to have her flip over at the back and squeezing. You can see that there is a good amount of fat deposit back here in the buttock area as well as in the flank. So I really feel like I'll get a higher yield going in the back than I will in the belly. And I'm going to demonstrate a fat graft harvest using the Lipogems system. This patient, we have decided that there are more fat deposits in the posterior flank area, so I'm going to make incisions on either side because I need a bit more fat because I'm doing both of her knees. So I'm going to make an incision around here so I can get at the fat here and one over here. First we're going to inject some 2% lidocaine. And I like to use an 1.5 inch needle on a that's 25 gauge. And we'll go on the other side as well. The incision that we need for this is quite small, about 2 to 3 millimeters to get the instruments in. And this is the instrument that we use for infiltrating the tumescence. It goes right underneath the skin. And I want to infiltrate in a fan-shaped fashion, starting superficial. And I put my hand on here so I can feel where I'm going with this. And then I go in the mid-layer, infiltrating as I go. And then a little bit deeper. You okay?
Mm-hmm. I'll let you know.
Okay. I have spiked the bag for normal saline, and then we will take the waste bag, which goes on the floor, and then hold on to the cylinder and open the clamp and the cylinder will fill from the bottom up, have the colored side down. This primes the system and gets rid of any air bubbles. And then we lock our clamps here. And we'll be ready for the fat to be put into the sealer after we've done the harvest. So I want to wait between 10 and 15 minutes before I harvest the fat. This is to let the tumescence circulate and absorb into the surrounding tissues. Then we're going to have a higher yield when I do the harvest. This is the instrument that I use for the harvest, and I'm going to insert it underneath the skin. I want to put it far enough so I'm able to achieve some suction. And I attach this special syringe that locks open. And now you can see the fat coming into the syringe. And I'm harvesting in a fan shape. We don't want to harvest in one specific area because a dead space can be created and a seroma can form in that area. And so I'm starting just like I did when I infiltrated the tumescence. I start superficial, and then I go mid, and then I go deep. I lost a little bit of suction there. So when that happens, just reattach the syringe, lock it open. When the syringe is filled, then I transfer to this larger 60 cc syringe. This connector comes with the Lipogems kit. So I've harvested the fat, and now we are going to inject it into the cylinder here in our system. I'm going to open up the clamp at the bottom. And then we'll run the saline through the system. You can see the clear saline coming here through the top, and then at the bottom the saline is mixed with, you can see it's looking a bit pink, and it's washing out the red blood cells and the cellular debris. And at this point what we're going to do is micronize the fat. So we're going to close off the system, and then we're going to shake it vigorously. The colored end, and I can aspirate saline here, close this off, so now we have a closed system, and we're going to push this syringe up through, and we'll see what happens on the other end. So this is the fat that we pulled off of the cylinder in our system, and we can see that the saline has settled at the bottom and the fat rises up, so we want to decant that off because we do not want to inject the saline. Okay. Strips over the incisions, 4x4 gauze, little pad here, and then I will just tape it on and she can remove it tomorrow.